The U.S. is reporting the lowest number of new COVID cases since last October. And here to explain what that may mean is Dr. Helen Boucher, Chief of Geographic Medicine and Infectious Diseases at Tufts Medical Center. Thanks for being with us.
Thanks for having me.
So we had 53,800 new cases nationally yesterday. A month ago, those daily counts were over 200,000. How significant is that drop?
Well, it's a very welcome and significant drop, Emily, but it's important to remember that we're still above where we were at the peak of the April surge, of our first surge. So we still have work to do, and now is not the time to take our foot off the gas.
To that point, we know the virus is mutating. The CDC now reporting more than 1,100 cases of the UK variant nationally. That includes a few dozen in New England. How quickly do you think that UK variant is spreading right now? And what would happen to our numbers if this becomes the dominant strain here?
Well, the concern is just that. So we know that the variant is in at least 40 states. And we are a little behind in sequencing to know exactly where the variant is. But so far we know it's here, and the concern is that it could become the dominant strain by the end of March. And we believe that it's much more infectious and transmissible, so that's a worry. So it means it's very important to double down on those mitigation measures of washing our hands, wearing a mask, watching our distance, not going to work or school when we're sick.
Yeah, all of that advice you've been telling us from the start, really. Pfizer got some new data about the effectiveness of its vaccine against that UK variant in Israel. What did that data show?
Well, that's really good news. So that's experience in over 600,000 people who received the Pfizer vaccine, and they saw 94% efficacy in that real world experience. So it tells us that the vaccine works as well in real life as it did in the trials. So that is just more reason to get in line when it's your turn and to accept that vaccine when it's offered.
What about the other vaccines? Do we have any data yet about how they fare against these variants?
Well, we're learning, and there is some concern that some of the vaccines may be less effective with especially the South African variant. That said, all the evidence so far shows that the vaccines prevent against hospitalization and death, the things we care the most about. So again, the message is to get that vaccine when it's offered.
Right, no matter which one is offered. Okay, Dr. Boucher, thank you so much for your time. It's good to see you.
You too, thanks.